Good morning. Can you all hear me? Welcome all to the 10th annual boot camp for science writers. I never thought that we'd reach the 10-year mark with this event. We began 10 years ago in a little room at the School of Medicine in Baltimore with just a few attendees. Soon thereafter, we moved to the SICE campus in Washington and had 40 to 50 attendees. And then we soon outgrew that venue, and for the past several years have been in the ballroom in the National Press Club, a fantastic location with great AV support and accommodation for the 100 or more attendees that will be with us today. I'm Stephen Desiderio, and I'm director of the Institute for Basic Biomedical Sciences at Johns Hopkins School of Medicine. It's our pleasure to sponsor this annual event, which gives journalists and other writers, communicators, an opportunity to spend a day learning from our experts and seeing them demonstrate how basic science concepts drive clinical advances. Now, why do we do this boot camp every year? First and foremost, because science is nuanced, and the stories don't always capture the nuance of science. Furthermore, with the deadlines that you face, it's challenging to get all the information you need to cover a story. And then I think it's a good idea once in a while to spend a day digging deeper into an area. And that's true for all of us, whether we're communicating science professionally or not. And lastly, because we at Hopkins want to help you get the story right. Now, perhaps more than ever, communicating about science is fundamental for the survival of science, particularly in the United States. In this environment, scientific fact is devalued, research funding continues to be precarious, and healthcare, of course, is uneven, it's rationed. As director of the IBBS, the Basic Sciences Institute, my goal today is to showcase for you how basic research affects everybody's health. There's increasing pressure on us as scientists to focus on outcomes and patient application. But without the pipeline of basic discovery, therapies won't be realized. Many of today's most spectacular treatments are based on discoveries made 30 or more years ago. Nowhere is that more evident than in the explosion of immunologic therapies for cancer that have begun to appear in the past several years, based on discoveries that as a young man I witnessed in Boston and elsewhere 32 years ago. And even as we talk about translational acceleration, most medical advances, if not all of them, will still come from basic research. I'd like to say a few words about Johns Hopkins. It's a behemoth. We operate 6 academic and community hospitals. We have more than 40 community sites, almost 3,000 full-time faculty, and more than 1,200 part-time faculty. Every year, the University of Johns Hopkins ranks #1 in federal funding for research, and each year the School of Medicine ranks second in NIH funding at $462 million currently. We have more than 1,200 medical and doctoral students at Johns Hopkins, and that is the engine that drives our science. It's been an honor for me to do basic research at Johns Hopkins for the past 34 or 35 years. At our institute, we have 9 departments that focus on the fundamentals of science, more than half a dozen interdisciplinary centers that bring together experts from different specialties, from the basic science and the clinical sides. More than half of the School of Medicine's graduate students do their research in our basic science laboratories. And nearly all of the fundamental preclinical courses for School of Medicine medical students are taught by our faculty. So essentially, our institute is an outstanding source for biomedical expertise, and I invite you to take advantage of us. For those of you who have attended past events, thank you for coming again. We can't emphasize how much we want this event to be for you. You've picked all of the topics so far every year: regenerative medicine, epigenetics, the genomic revolution, the brain, heart disease, diabetes, and immunotherapy. After this event, you'll receive an email, a survey. Please fill it out. We review each survey, and we use it to choose future topics. This year's topic is the price we pay, growing old in America. According to the Census Bureau, by the year 2030, 1 in every 5 U.S. residents will be 65 and older. By 2035, older people will outnumber children. The graying of America also means that we have huge populations of people with chronic conditions, and this accounts for a large share of our national healthcare budget. So the question is, are we ready for this bubble? Are we ready for the largest ever aging population on Earth? Solving this means that we need to uncover the mysteries of age-related diseases, repair disparities in health outcomes, provide access to care, and mitigate the rising costs of health care and medication. We've lined up an impressive variety of speakers for today's event. You'll hear from basic scientists who study the basic molecular and biological processes that underlie aging, as well as from clinician scientists who manage illness and develop new therapies. Through the early afternoon, each of our experts will give presentations for about 10 minutes, and you'll have the opportunity to ask them questions about their talks in the remaining 5 minutes of the time slot. Please keep the questions succinct and in the form of a question so that we can keep the program moving. Then later this afternoon, we'll have 2 panel discussions filled with a deep bench of experts who are going to discuss the cost of drugs and how to improve healthcare overall. You'll have the opportunity to pose questions to these panels as well. But don't just restrict your questions to those times. Most of our experts, or at least some of them, will be joining us for almost the whole day. So feel free to talk to them at the breaks, at lunch, and you're welcome to follow up. They'll welcome your follow-up emails for interviews after today. We have one programming change. Dr. Mark Mattson was supposed to talk at 12:30 today about fasting and exercise mechanisms. He can't join us today. But if you'd like to follow up with him for an interview, just email our media team. Our media team is shown on the slide. Many of them are here today. Their name tags read staff. Their areas of expertise and their contact information are listed in the program. As you listen to today's presentations, our Twitter audience is following us. Yes, we have a Twitter audience, and it's sizable. Following us at Hopkins Med News. Use hashtag JHMBootcamp. I think at my age, that's the first time I've ever used hashtag in a sentence to follow the conversation today and join the discussion. With that, I'll stop my presentation and we can begin the body of the event. So to start off the day, it's my pleasure to introduce one of the world's foremost experts on aging, Jeremy Walston. Jeremy is a professor of medicine and co-director of the Biology of Healthy Aging program in the Division of Geriatric Medicine and Gerontology at Johns Hopkins. Jeremy has developed the most commonly used definition of frailty and identified pathways that influence frailty and decline among our aging populations. This will be the focus of his talk today. Jeremy, thank you very much.